April 4th, 1979. Number 24 Hospital, Sverdlovsk, USSR. One patient after another dying of pneumonia, hemorrhaging of the lungs and lymph nodes, cerebral bleeding forming a red ring around the brain. Within days, at least 66 were dead. Diagnosis: anthrax. As science and public health modernized, epidemics and infectious disease ceased to be the leading cause of death in developed nations. Instead, chronic disease became the primary killer, as sedentary life and excess unhealthy food flooded American arteries. Trauma and accidents have stayed largely unchanged. What would it take to plunge the developed world back into plague? In Plagues and Peoples, William McNeill offers 3 potential causes. 1. Evolution and resistance of old microorganisms to modern medical practices. We already see this with the rise of MRSA, as it becomes progressively resistant to more and more antibiotics. 2. A second possibility is that some previously unknown disease might become epidemic. We've seen this countless times with Zika, Ebola, swine flu, avian flus, SARS, HIV, and so on. 3. Most ominously, intentional biological research could develop uncontrollable and untreatable disease as a weapon of war. This is what happened in Sverdlovsk. Following Japan's development of weaponized anthrax during World War II, the USSR began its own research, imitating the Japanese plans in the city of Sverdlovsk. 30 years prior to the Sverdlovsk outbreak, every major power had a germ warfare program. France, England, Japan, and the United States all manufactured offensive strains of anthrax and other agents. However, accidents were inevitable, and close calls were numerous. In one test at the Dugway Proving Grounds, a U.S. Air Force F-4 Phantom accidentally leaked some of the nerve agent VX over a herd of sheep. The next day, farmers arrived to find 6,000 sheep dead. In the face of such risks and the all-powerful nuclear option, President Nixon made a tremendous decision.
Biological warfare. It may produce global epidemics and profoundly affect the health of future generations. Therefore, I have decided that the United States of America will renounce the use of any form of deadly biological weapons that either kill or incapacitate.
Soon thereafter, the Biological Weapons Convention Treaty banned the development, production, and stockpiling of biological weapons. Surprisingly, the USSR signed on. Unsurprisingly, they were lying. In private, Nixon said of the Soviets signing the Toothless Convention,
"The sense is to make you sit there with the Soviet ambassador at the time they were raiding from South Vietnam and say that they made a great contribution to peace by signing a silly biological warfare thing which doesn't mean anything. Now you know what I know."
Nixon was right. The Soviet biological weapons program continued, stronger than ever, and the anthrax outbreak at Sverdlovsk was proof. In Sverdlovsk, a military compound was researching and producing massive quantities of anthrax. Gennady Lepeshkin, a former director in the Soviet biological warfare program, explains.
Там было нарушение технологической инструкции при работе с биологическим материалом, и биологический материал вышел за пределы рабочего помещения, за пределы рабочего корпуса. И произошло заражение местности и людей, естественно, которые находились в это время на улице.
A filter had been replaced incorrectly. Anthrax spores, carried by the wind, spread to the nearby town, infecting over 100. At least 66 were confirmed dead in the coming days. Anthrax, however, was the tamest of the biological weapons developed by the Soviet Union. Ken Alibek, former second-in-command of the Russian Biological Warfare Agency, explains.
I'd like to say that completely finished and accomplished biological weapons were as follows. Smallpox biological weapon, then plague biological weapon, anthrax biological weapon, Venezuelan equine encephalomyelitis biological weapon, tularemia biological weapon, brucellosis biological weapon, and some others. Smallpox was declared eradicated in 1980. And just immediately after this government, the Soviet Union government realized that nobody would have defense in the future against this agent, just because it was declared that there was no necessity to vaccinate people anymore. In 1990, Vector developed industrial technique to manufacture this virus for manufacturing biological weapons. It's a completely new technique to obtain huge amounts of this virus.
And that is for use as a biological weapon?
Of course.
With the weaponization of plague and smallpox, germ warfare moved beyond battlefield tools to strategic weapons capable of massive and global devastation. These weapons could be aerosolized and deployed by aircraft or intercontinental ballistic missiles. The question is, what would it take to respond to a sudden outbreak of such a disease, and what damage would be wrought?
I don't want to set the world on fire. I just want to start a flame in your heart. In my